Coverage of the 28th annual meeting of the ASMBS is brought to you by Bariatric Advantage, the most complete line of micronutrient replacements specifically designed for the weight loss surgery patient. Click on this ad to order yours today.
Hi, this is Linda with BariatricTV. I'm here in Orlando, Florida at the 28th annual meeting of the ASMBS. I'm here with Dr. Scott. Dr. Scott had a study that he presented at this year's meeting. So Dr. Scott, tell us a little bit about yourself and your study.
I'm a bariatric surgeon. I work in Greenville, South Carolina at the Greenville Hospital System Bariatric Solutions. I've been doing bariatric surgery since 2006 and presenting a paper here today on bariatric surgery and the risk of having heart attacks and strokes.
And what did your study find?
Our study showed that for patients compared to bariatric patients compared to orthopedic and gastrointestinal surgery patients, that the bariatric patients had a 25 to 50% lower risk of having a heart attack or a stroke after they had their surgery.
Was there any timeline in that? Was it immediately after surgery? Did you follow them for a year, 2 years, 3 years?
The study ran from 1996 to 2008.
Oh, so quite a little span of time there to be watching these folks. Is there anything else you want to tell us about your study?
We also showed that the risk of having a first-time heart attack was reduced by about 40 to 50% in the bariatric group versus the orthopedic and GI surgery groups.
So do you think that that's going to have any effect in insurance approvals for patients going forward?
I would like to think so. I think the body of evidence that's accumulated has shown consistently that bariatric surgery helps people lower their risk of having major cardiovascular events such as heart attacks and strokes and death. And the evidence is overwhelming in terms of patients that have surgery versus patients that do nothing about their weight.
Awesome. Is there anything you'd like to say to our viewers?
I think this is a good study because I think it's very important, especially for our patients that are making that decision to have surgery. I know it's a dramatic lifestyle change and it's a big decision for them to make whether or not to have surgery. And I think this paper, along with all the other papers that have been written about reducing the risk of getting diabetes and reducing the risk of death, helps patients make that important decision whether or not to have bariatric surgery.
And doctor, do you have a website where folks can find out more about your practice and see this video once it comes out?
Sure. It's www.bariatricsolutions.com.
Fabulous.
Ting!
Ting! Thank you.